Welcome to our Pharmacology board exam review session. So pharmacology is an intense subject, and what I've tried to do here is summarize it as easily as possible. So let's start with the first slide, which is what is the definition of pharmacology? Well, anything that ends in ology means the study of. So if you think of periodontology, that's the study of the periodontium. You think of zoology, that's the study of animals. So pharmacology is the study of drugs, the study of medicine. And when we look at names of medicine, there are three different drug names. There's the chemical name, the trade name, and the generic name. And so let's look at this. Here is a list of all the different chemical names. And what you'll notice with the chemical names is that it's quite long and it just discusses the different chemical components. But when you look at the generic name, that is the name that starts with a lowercase letter. If you compare it with the brand name starts with an uppercase letter. This is for marketing. This is the name of the medicine, but the brand name, this is the one that they use for marketing purposes. So if you look at Tylenol, for example, that's the brand name, but when you look at the generic name, it's acetaminophen. That is the name of the medicine. And so there could be other brands. There could be a no-name brand, which works just as well as the Tylenol. As long as they have acetaminophen, it will work effectively. And the chemical name is a longer name. So all are trade names of drugs except which one? If you said lidocaine, you are correct. Lidocaine would be considered the generic name because it's in lowercase, but all the other ones are trade names or brand names because they are in uppercase. Then in pharmacology, we look at something called potency and efficacy. And potency is basically how much drug do you need to produce an effect? How much drug do you need to feel better? And so let's look at drug A, and we're going to compare it to drug B. At the bottom, we have our dosages. So let's say this is 0, this is 100, this is, let's just say 200, and we're going to use milligrams. If you look at drug A, you need 100 milligrams of drug A to get better. So let's say this is the effect, so to feel no pain. So let's say you're in pain and you took drug A. With 100 milligrams, you got to feel better. With drug B, you need to take a bigger dose. With 200 milligrams, you felt better. What does this mean? This means that drug A is more potent than drug B. You need less doses of drug A to feel better. So the less amount you need, the more potent it is, the more stronger it is. So this drug is more potent to get the desired effect. So here, if we look at it, if we compare 10 milligrams of morphine versus 10 milligrams of meperidine, both used to treat severe pain, 10 milligrams of morphine will work. It will be effective. It will help you with treating the pain. But 10 milligrams of meperidine, no, that's not going to work. So the dosage is important. Sometimes you need to take a higher dose to get that effect. Efficacy, if you look at, on the other hand, let me bring that slide up, is how much, or what is the maximum intensity of effect that can be produced from a drug. So if I look at this here, drug A and drug B, which one do we get the most maximum effect? Drug A, right? Because drug A is higher. If you look at the effect, this is where you get the most maximum effect. Drug B, you might feel okay, but drug A, you'll feel a lot more better. And so drug A has the maximum effect. There's more efficacy in drug A. Sometimes when you look at the dosage, if you look at drug B, where you get the maximum effect here, and drug A, where you get the maximum effect here, which drug is the one where you need less dose? Well, the blue one, drug B, is the one where it's more potent. It's the one where you need less dose to reach the maximum efficacy. So what is the maximal intensity of effect or response that a drug produces? Is it potency? Is it tolerance? Is it efficacy? Or is it toxicity? Yeah, it is efficacy, because if we look at the definition of the maximum intensity of effect, that can be produced by a drug. So drug A produces more effect than drug B, where you just feel okay. Drug A, you feel a whole lot better. Tolerance, we're going to look at later today. It's let's say I take one pill and I feel better. So with one pill, I feel good. Tomorrow, I take one pill and I don't feel good. So maybe what I'll do is I'll have to take 2 pills and then I'll feel good. So tolerance is now if you take more pills to feel good. That's drug tolerance, where 1 pill isn't enough. You need 2 now. Toxicity, that's when the pill does harm to you. So when you have harm, when you're not feeling well because of the pill, it could be because of toxicity. Pharmacokinetics, this is how the drug enters your body and how your drug leaves the body. So what happens as it enters and how does it even leave the body? So there's 4 things, and the way to remember this is by thinking of ADME. And ADME, A stands for absorption. So how does it get absorbed? Here we see oral absorption. It gets absorbed through the mouth. But there are other ways of absorption. It could be, think of a nicotine patch. It could be absorbed through the skin. Think of getting an epidural. Medication or drug could be absorbed through the spinal fluid. Think about when you get an IV done. Medication could be administered intravenously. So there's many different ways drugs can get absorbed. Then distribution. Where does the drug go in your body? Metabolism or biotransformation, there are interchangeable words. Where is it broken down? Now typically drug is broken down in the liver, but some drugs could be broken down in the kidneys, so it depends. Where is it broken down? Where do the drugs break down? And then excretion, how does it leave the body? Do you pee it out? Is it urine? Is it stool? Is it saliva? Is it sweat? Is it tears? Like how is it milk? How is it excreted from your body? So here's a question. The primary organ involved in metabolism or biotransformation is the liver. Majority of the main organ used for breaking down drugs is in the liver. There's something known as half-life. So every drug has a half-life, and half-life basically means does it take for half the drug to come out of your body. So if let's say I take a drug, and let's say the half-life of the drug is 4 hours. Okay, that's what I'm told. The drug's half-life is 4 hours. 4 hours later, half of the drug leaves your body. 50% of the drug leaves your body. Then 4 hours later, 50% of that, so 25% of the drug is left in your body. 50% after, or 4 hours after that, 50% of 25% is 12.5. So half of 25 is 12.5. 12.5% of drug is remaining in your body, but everything else has all the other, like 100 minus 12.5, which is 87.5, has been released from your body. So after that, 4 hours later, 50% of 12.5 is 6.25%. So 6.25% of drug is left behind in your body. And then when you go 4 hours after that, hopefully every single drug that was left in your body is now flushed out, is now eliminated. So in general, it takes anywhere from 4 to 5 half-lives for the drug to be completely gone from the body. Okay, and every drug has a half-life. So 4 to 5 half-lives is what it takes for it to be eliminated, for the drug to be gone from your body. How many half-lives are required for a drug to be essentially removed from systemic circulation? Well, we just went over this, right? The answer is 4 to 5. So anywhere from 4 to 5 half-lives is needed for the drug to be removed from our body. Now, when we look at onset and duration, onset means how long would it take for the drug to start working? So, for example, if you think of date weight drugs, there are some drugs like ketamine, for example. As soon as you take that drug, so as soon as they put it in your drink and you drink it, within 5 minutes it kicks in and they can rape you, unfortunately. And then duration is, well, how long do they have? How long do they have to take advantage of you? They have 30 to 60 minutes to take advantage of you. Now, God forbid this ever happens, but this is a good way to remember onset and duration. Onset is how long does it take for it to kick in? Duration is how long will it stay in, will it be working for? How long will the drug, the length of time of a drug's effect, how long will the drug work? Now, when we look at how drugs enter our body, there are two routes. There is enteral and parenteral. The difference between the two is enteral is when something enters your GI tract, your gastrointestinal tract, your digestive tract. So if you take medication orally through your mouth, of course it's going to enter your digestive tract or your GI tract. If you take something sublingually, so sometimes you put medication and you just let it sit there underneath your tongue, that will enter your GI tract. And rectally, there are some medications that has to be taken rectally, especially if you're unconscious or if you're vomiting like crazy. That is done rectally. And so again, that enters your GI tract. So those are the enteral routes of administration. But parenteral routes of administration are everything outside the GI tract. So think about injection when we're injecting IV, right? That's parenteral. If you're inhaling something, you're breathing something, a drug like that is another example. Or topical, if we apply some cream on your skin, that is an example of parenteral, a route of administration. So the oral route is most common, but the only downside with that is it's a slower onset of action, so it takes a longer time for it to kick in because it has to go through the digestive tract before it gets, before it gets to where you want it to go. So it does take a long time for it to kick in. Rectal is another route of administration, which is enteral. So drugs can be given as suppositories, creams, or enemas, and this is obviously poor patient acceptance, right? Not many patients want that route, but they have to if they're vomiting or unconscious. So sometimes some drugs need to be administered that way. The IV, the intravenous, is the best one because you get the most rapid drug response that way. So it literally goes into your bloodstream, and that's the best way that you can administer drugs, or drugs can be administered to you, because you bypass that whole absorption base. It doesn't need to be absorbed. It goes straight into your bloodstream. There's also intramuscular. The COVID-19 vaccine was injected intramuscular on your arm, so it was injected into the muscle. We have subcutaneous, so we have this one right here. And subcutaneous types of drugs are insulin. If you need to take insulin because you're diabetic, it would be injected subcutaneously. People who take drugs like opioids, those are injected into the skin subcutaneously. Think about EpiPen when you're allergic and you need an EpiPen. That is also injected subcutaneously. So muscle is deeper, subcutaneous is like right here. And then we also have other routes such as intradermal. So dermal means into the epidermis of the skin. So into the skin, that's like your TB test. When you got your tuberculosis skin test done, it was intradermal. If you ever have an epidural, that is intrathecal. So many routes. There's also inhalation. This is nitrous oxide. When you need to go to sleep for surgery, that's another option. So these are ways drugs are administered while you inhale it. And then topical. So the ones we can think of are the nicotine patch. If you're thinking of stopping tobacco, so stopping the smoking. There are also birth control patches. There are also patches that deliver. Or actually, for us dental professionals, there are also topicals that you can put inside someone's gums, like perio chip, which is a chlorhexidine chip that you can input subgingivally, and that's also considered topical. So when we're looking at drugs, there's something called drug agonist and drug antagonist. An agonist basically means that the drug fits perfectly into the receptor, and so when it fits perfectly into the receptor, which is hanging out on the cell, for example, then that means that the drug will work. So if it's a perfect lock and key, it will work. It will work and you'll feel better. Antagonist is where it doesn't fit into the lock and key, they don't fit, and the drug will not work. Sometimes what will happen when you have a drug antagonist is that the drug will do a reverse. So for example, you know how some people are really high on opioids, for example, and so sometimes we call 911 because they're too high, they probably passed out. Then when the 911 when someone comes to rescue them, they'll inject a drug, which we will talk about today, and is called an antagonist drug, and that drug reverses the action of the opioid. And then we have partial agonists, where it didn't exactly fit, and so you get a small response. You might feel a little better, but not completely better. So agonist is the perfect combination where the drug will work. Antagonist is where the drug won't work. And then partial agonist is where the drug kind of works. We talked about drug tolerance. So the first time you take it, you're okay with one pill, but after a while you find that one pill isn't cutting it, and now you got to increase the dose, and that's building drug tolerance. Therapeutic index is our next important point to note. So every time a drug is manufactured, they have to figure out what the TI is, what the therapeutic index is. And what they do is they take the lethal dose and they divide it by the effective dose. And there's a video explaining the definition. I've made a video on this before. But basically what they do is they take this drug. So let's say they test the drugs out on rats. And let's say they give 100 milligrams, okay, to all the rats, and they find that 50% of them died. So the only leftover rats that remained alive are 1, 2, 3, 4, and 5. So 5 rats are left behind, are left alive. That's your lethal dose because 50% of them died. Okay, then you divide it by your effective dose. So again, you find another 10 rats, and you notice that the drug worked on 50% of them, and maybe you gave them like let's say you gave them 50 milligram, and you found that 50 milligram worked on 50% of them, so on half of them. That 50 means on half of them. So that is your effective dose. Then what you do is you divide them, and if you get a small number, okay, so if you get a small number, like a number of 3, that's really bad. It's toxic. The drug is harmful to take. You can't use that. But if you get a high number like 10, well, that's really good because that drug is effective. So if I do this one, if I take the lethal dose, which was 100, and if I divide it by 50, what did I get? 2. 2 is really toxic because it's a small number. So you don't want to give this drug to the public because it's very toxic. It's very bad for you. So this is a drug that you would not give to the public. But if you have a high number, if you got like a 10 or higher, then it's less toxic. So it's not as bad. So if the therapeutic index is small, like 2 or 3, then it could be very toxic. So it is not recommended for us to use. Drug A has a therapeutic index of 2. Drug B has a therapeutic index of 10. Which drug has greater potential for toxicity? And if you said drug A, you are correct because the lower the number, the more toxic it is, right? Remember this. The lower the number, the more toxic. The lower the number, you can see it's in the red zone. It's really bad. We like high numbers when it gets to the green zone. Okay. Let's move on to the pharmacologic effects of cholinergic agents and anticholinergic agents, which I know sounds like a mouthful. When we look at this, we're going to be checking out, or we're going to be recapping what the autonomic nervous system is, and we're going to compare it to the parasympathetic autonomic nervous system. Now, when I think of the sympathetic autonomic nervous system, I think of someone who's scared. I think of someone who is stressed. Remember, the S from sympathetic autonomic nervous system, you can think of it as someone being stressed. Or I didn't spell that properly because I just moved something. I'm just going to reposition that. So someone who is stressed or someone who is scared. Okay, so S for sympathetic autonomic nervous system. And when you think of parasympathetic autonomic nervous system, don't you think she looks kind of peaceful maybe? So think of peace. P for parasympathetic autonomic nervous system, P for someone who is peaceful. Okay, now let's see what happens. If you're scared, if you're being chased by a bear, you'll probably look like him, where you're freaking out and your eyes are dilated, right? Think about when you're chased by a bear, what happens to you? You dilate your eyes, your pupils just open up. Your mouth dries up all of a sudden, so your salivary flow will be reduced. Your heart rate will be pumping really fast, because when you're really scared, your heart rate pumps really fast. Your lungs will open up. You'll open up because you need a lot of oxygen to be able to run fast and run away from him. So you need oxygen. So your lungs are going to open up. Your digestive system is also not going to work as well, because that's right here, inhibits digestion, because your body is not worried about digesting food. It wants to run away, so all its energy is going to focus on you running away by increasing your heart rate, opening up your lungs. And in your bladder, you're not going to feel like you want to go to the washroom, because right now you just want to run for your life because you're being chased by a bear. So all these symptoms will happen to you. If you look at the parasympathetic autonomic nervous system, when you are at peace, when you're peaceful. So let's say you just ate a wonderful dinner and now you're just chilling on the couch. You could fall asleep, so your pupils could get smaller, could get constricted. You could start drooling. If you do fall asleep, you'll probably drool, right? Because it does stimulate. You get more salivary flow, you get more saliva. You don't need a lot of oxygen, so your airways will constrict to its normal size. The heartbeat, your heart's not going to be pumping really fast because you're relaxed, so your heartbeat will be pumping slowly. And this is when digestion will be happening. And sometimes you may feel like, okay, maybe you do need to go to the bathroom. So the reason why I'm telling you this is because there are drugs that help you or mimic these type of symptoms, and then there are drugs that help you or mimic these type of symptoms. So for example, what if I had a very dry mouth? So I had a very dry mouth and I need more saliva. If I have a very dry mouth and I need more saliva, do I want a drug that will mimic the sympathetic autonomic nervous system, or do I want a drug that will mimic the parasympathetic autonomic nervous system? I want more saliva. Yeah, it is the parasympathetic autonomic nervous system, because when I am feeling like her, I'm going to get more saliva. So I want a drug that will help stimulate this type of system, this autonomic nervous system, so I can get more saliva. So if you look at the bottom, it says cholinergic agents or antiadrenergic agents. If you get a drug from this category, cholinergic agents or antiadrenergic agent, it will mimic these symptoms. If I get a drug from these categories, so an adrenergic agent or an anticholinergic agent, then it will mimic these symptoms. So for example, let's say my heart rate is really slow and I need it to get a little bit faster because it's too slow, and my doctor's worried. They might give me a drug from this side to mimic or to allow my heart to just pump a little bit faster so that it's not too slow. And so I would probably get an adrenergic agent or an anticholinergic agent. Now let's look at what these words mean: adrenergic and anticholinergic or cholinergic. So when you take a drug, what happens is the drug sends a signal to the brain, the central nervous system. And then the central nervous system sends a signal to your mouth, for example, or to the salivary glands, for example, and tells them to, in this case, inhibit salivary flow, to stop producing too much saliva. But how does this happen? So there are signals that get sent. So when you take an adrenergic agent, when you take an adrenergic drug, what happens is a message gets sent to the brain. The brain then sends neurotransmitters, or they send signals, neurotransmitters, to the, I'm just explaining really briefly, to the salivary glands, which tells the salivary glands, okay, you need to stop making saliva. So these neurotransmitters that are in the sympathetic autonomic nervous system, these neurotransmitters are called norepinephrine. I'm just going to write this down, and epinephrine. And what these neurotransmitters do, imagine them to be like dots. And so there are neurotransmitters these are dots that get sent And what the neurotransmitters are doing are they're sending the signals to, let's say, to the eye. And what happens is these neurotransmitters have to bind to a receptor. So imagine there's a receptor here. So the neurotransmitters binds to this receptor, and then the receptor, once it binds there, then they send a message to the eyes and tells the eye to open up. So there are neurotransmitters. These dots are known as norepinephrine or epinephrine in the sympathetic autonomic nervous system. They have to bind to a receptor. Once it binds to a receptor, it will send the message and tell the eye to open up. The name of this receptor is an adrenergic receptor. So an adrenergic drug or an adrenergic agent are drugs that help you open your eyes, are drugs that help you inhibit salivary flow, are drugs that help you relax your lungs. Sometimes you can have drugs that are that's just right here, anti-adrenergic. What does that mean? That means they block the receptor. And so the neurotransmitters can't bind. And when it can't bind, you get the opposite effect. So this is what happens when neurotransmitters don't bind to the receptors. It's an anti means it's blocked, anti-adrenergic agent. We can say the same thing here. When you take a drug, it sends a signal to the central nervous system, and then the central nervous system sends a signal to the heart, for example, and tells the heart to slow down. Again, the neurotransmitters for the parasympathetic autonomic nervous system is known as, this is the way you write it, acetylcholine, capital A, capital C, lowercase h. So these are the neurotransmitters. Those are, imagine if you will, dots. So again, the brain sends a signal, there's dots that gets released. These dots are known as neurotransmitters, which are called acetylcholine. They bind to a receptor, and let's call this receptor a cholinergic receptor. This is a cholinergic receptor. When it binds to the when the acetylcholine binds to the cholinergic receptor, it will send a message and tell the lungs to constrict, tell the lungs to just close a little bit. So again, you could have an anticholinergic agent drug where you take a drug and it prevents the neurotransmitters from binding to the receptor, and then you get the opposite effect. So if you have an adrenergic drug or adrenergic agent, it will mimic these symptoms. If you take an anticholinergic agent, it will again mimic these symptoms. Whereas if you take a cholinergic drug or an anti-adrenergic agent, it will mimic these symptoms. So let's look at this. Which terms refer to the same groups of medications? This may look confusing in the beginning, but let's go over it together. Let's look at this first option, sympathomimetic, cholinergic. Do they go together? Well, let's see. Sympathomimetic is over here, and cholinergic. Is cholinergic a word that you see here? No, I see anticholinergic, but not cholinergic. So no, that is not an option. Let's look at this one. We're going to skip this one. Adrenergic and parasympathemimetic. Let's see if they go together. Adrenergic and parasympathemimetic. So here's the parasympathetic system. Do we see adrenergic here? No. We see cholinergic and we see anti-adrenergic. So no, they don't go hand in hand. So this is not. When I look at this word parasympatholytic, that doesn't make sense to me. I've never heard of that word. It's not one of the words we're looking at. So this is also not an option. But let's look at this one. Sympathomimetic and adrenergic. Sympathomimetic, this is the sympathetic system. And it said adrenergic. Adrenergic is a drug that goes, that you can use to mimic these symptoms. So that makes sense because adrenergic and sympathetic system go together. So this is your answer. Pilocarpine, this is a drug Saligen. This is a drug that's used to treat xerostomia. So this type of drug is actually, if we look over here, what type of drug do you think that is? And I know we touched on it briefly. If you take Saligen, which is a drug that stimulates salivary flow, would it be in the parasympathetic system or would it be within the sympathetic autonomic nervous system? Yeah, it would be this one because with the parasympathetic system, you get more salivary flow. So it is actually a cholinergic drug that drug that we looked at, which is right here, is a cholinergic drug. Pilocarpine is a cholinergic drug that stimulates salivary flow. It's used to treat dry mouth. Okay, we're going to shift gears here. We're going to go straight to hypertension. So if someone has high blood pressure, what drugs can they take? Well, I want you to think of A, B, C, D. A for angiotensin converting enzyme, ACE. A can also be for angiotensin 2 receptor blockers, so ARB. That's what the A refers to. B refers to beta blockers. C refers to calcium channel blockers. And D refers to diuretics. Okay, well, let's recap. Let's just try to analyze all of these. So this is A, right? When we think of hypertension, we're thinking of A, B, C, D. There's 4 drugs that they could potentially take. A stands for ACE or ARB. Now what these drugs do is they narrow the blood vessels. So in your heart, they don't narrow the blood vessels. What happens is in your heart, we all have an enzyme that narrows the blood vessel, and we don't like it. Imagine this is your blood vessel. Do we want our blood vessel to get even more narrow? If it gets even more narrow, what's going to happen is blood won't be able to flow as effectively, and then it won't circulate in our heart as effectively. So what this drug does is an inhibitor. It stops the blood vessels from getting smaller. It inhibits the narrowing of the blood vessel. So this drug, it inhibits the enzyme, which is called, the enzyme makes this thing called angiotensin 2. And angiotensin 2, what it does is it causes this. It causes the narrowing of the blood vessel, which we do not want, because if that happens, our blood won't pump as effectively, and we will get high blood pressure. So what I want you guys to do is think about, when you think of ACE, these type of drugs, know that it ends in pril. Okay, PRIL. They all end in pril. And interestingly enough, it has a dry cough. That's like the biggest side effect. So perhaps to remember this, you could think of yourself playing cards, and let's say you pick up a pile of cards and you get all ace cards. You're playing during the month of April. Okay, April for April. And as you're playing this card game, you find that you have lots and lots of dry cough. Okay, so imagine yourself, you're playing this the game, and you have like all aces you picked up. You're playing like a card game, okay, and you picked up aces. It is the month of April, and you're coughing, okay, and you're coughing a lot. If you remember this, that's how you can remember ACE. Another drug that they could take is an angiotensin 2 receptor blockers, or the ARB. And what they do again is they block the blood vessels from getting small. So ARB, they end in tan, like losartan. They end in tan. So when I think of ARB, I think of like Airbnb. So when you go for a vacation and you might want to rent out Airbnb, and when you go and rent out an Airbnb, you might get tan, right? Maybe you're renting out a warm place and you go in there and you get tan. That's how you can remember Airbnb, ARB for tan. They all end in tan. Beta blockers. This is the one that I have learned from StudentRDH. So I give StudentRDH has great memory tricks. When you look at the ending of all the beta blockers, so beta blockers are good because they allow the heart muscles to contract nicely and they relax your lungs. So when you look at this word olol, okay, I'm going to write it out here. What I want you to do is I want you to combine the O and the L together. And what happens? You get D. Then I want you to flip the D to a B. B for beta, B for blockers. That is a trick that StudentRDH taught us, and I think it's a really good trick because now we can remember that anything that ends in olol is a beta blocker, which helps with hypertension, which helps with high blood pressure. The other drug that we want to keep in mind is calcium channel blockers. So this is another thing that helps with hypertension, that helps with high blood pressure. And what this does is let me rephrase that. What calcium channel blockers do is they block calcium. They block calcium from entering into the heart. And the reason why they want to block calcium from entering into the heart is because what calcium does is it causes the heart and all the arteries to squeeze or to contract a lot, like very strong. contract more strongly. And so if you block the calcium channel blockers allow the blood vessels to relax and open. So again, we don't want the blood vessels to become narrow like this. We want the blood vessels to be opened up. And so if you inhibit calcium, because calcium is really working hard to contract the the arteries in the heart, we don't want that. We want the calcium to open up the arteries. So if we inhibit the calcium, we can get the heart to pump better, and that will help with the blood pressure. Now, calcium channel blockers, they end in pine, nifedipine, right? They end in pine, and same thing here that we see. How can you remember this? Well, think of, again, this is from StudentRDH. Imagine yourself living in California, because when you think of calcium, think of California, and in California, they have a lot of pine trees. Okay, so imagine pine trees, and you're living in California, okay? And you're in California. So that's how you can remember calcium, California, and in pine. Another cool thing I learned from StudentRDH is calcium channel blockers such as nifedipine, which is a really important one for you to know, causes gingival enlargement or gingival hyperplasia. So how can you remember this? Well, you take this C, you take the other C, okay? And I'm going to flip this C over like that, and then when I combine it, I'm going to get an O, and I want you guys to picture this O, right? So when you think of this O, that's calcium channel blocker, and it causes gingival enlargement. The gingival enlargement is caused by calcium channel blockers such as nifedipine. Lastly, we have diuretics. Diuretics is a water pill. Think about when you have like swollen feet. Your kidneys and heart kind of go together. And if you have an issue with a kidney that is causing like swelling of your feet, you probably also have an issue with the heart. They kind of work hand in hand. So they end in IDE. So they end in IDE. And the way I remembered it is in diuretics, we have the I, we have the D, and we have the E. So they have diuretics have the ending IDE. So again, to recap, blood pressure, hypertension, think of A, B, C, D. There are 4 types of drugs that can cause, that can allow the hypertension to be decreased, that can cause the blood pressure to become lowered. Now, if you have a heart failure, congestive heart failure, so if your heart is not pumping properly, there is another drug there's a drug that you can take, and it's called digoxin. And digoxin, what it does is it allows the heart to contract better, and it allows for a deep contraction. So think of D for digoxin, D for deep contraction, like this guy's doing, digging deep, and you're digging, it decreases the heart rate, and you're digging for a deeper contraction. So sometimes you need a deeper contraction to allow your heart to start working better. And so digoxin is the drug of choice for that. The sad part is sometimes because of when you take digoxin, it does have a lot of toxic effects. So it can be really toxic. We can get some brain effects. We can get the heart rate to be abnormal. We can get even some tummy upsetness. And the way to remember that it has very toxic effects is if you look at the word digoxin, it sounds like toxin. Toxin sounds like toxic. So toxic effects are common. Interestingly enough, though, this is important for us, are oral effects. So when you think about us, as dental professionals, what we would notice is that we would see that our clients might have a lot of saliva, copious salivation. So lots of saliva. Salivary flow can happen if you take this drug. What about people with chest pain? So angina means chest pain. If you have chest pain, you might want to take nitroglycerin. Okay, this is something very important because when medical emergencies happen in our chair, we need to make sure that our emergency kit is equipped and has nitroglycerin. Nitroglycerin, what it does is it dilates, it opens up. Vasodilation means it opens up. So if you take nitroglycerin, it will open up this artery so that the blood can flow, because right now the blood is blocked because of all the plaque in the arteries, and so we need the blood to flow better. So if we open up the arteries, which can happen with nitroglycerin, if you take nitroglycerin, the arteries can open up, which is called vasodilation, so that the blood can flow nicely and pump in the heart. It's usually a tablet that we give them, and you tell them to put it underneath their tongue, And what happens is once you tell them to put it under their tongue, if you don't see an improvement, you can give them another one 5 minutes later. If you still don't see an improvement, you can give another one, a third tablet, 5 minutes after that. And then you must take them to the ER. If they still, are feeling a lot of chest pain, you must take them to the ER. I mean, I would still take them to the emergency no matter what, but this is just a rule of thumb. Now let's look at blood thinners. So sometimes when you, have your heart rate is not, you have lots of heart issues, it could be because the blood is not flowing nicely, as we see in this photo. So what if we get a blood thinner? Sometimes you might need a blood thinner so that the blood can flow nicely. And so an example of a blood thinner is warfarin, also known as Coumadin. So warfarin is a generic name, Coumadin is the brand name. And what happens is it thins the blood so that the blood can easily go through, especially in areas where it's too tight for the blood to go through. So how can you remember that this is a blood thinner? Well, again, this is from StudentRDH. When you see the word warfarin, do you see the word war? So war means lots of bleeding during the war. So if you imagine that you're in a war and you're bleeding like crazy, that's how you can remember warfarin is a drug that causes it's a blood thinner because it causes a lot of blood. It doesn't cause a lot of blood, it basically means that the blood gets very thin. So that's how you can remember it, that it's associated with bleeding. And Coumadin, think of coma, you can see how coma came out from there, and think of people in the war bleeding because bleeding out and that they got into a coma. So if you imagine that scenario, you might be able to link these two drugs together, that they go hand in hand and they are blood thinners. Other blood thinners are aspirin, which we will talk about, and Plavix. Interesting point to note is that if someone is on warfarin, which is the blood thinner, you need to know what their INR number is before you proceed with treatment. And so they do this themselves. They can go to get tested in a lab and they'll tell you what their INR number is. So always ask for their INR number, and they are aware of this. All these individuals, the patients that take warfarin, they know because they have to go regularly and get tested for their INR number. If their INR number is 3 and under, we can go ahead and proceed. But if their INR numbers are higher than 3, then we do not want to debride their teeth because they might bleed out. It will take a long time for the blood to clot, for it to stop bleeding. So we cannot proceed with treatment if their INR levels are above 3.